Extend the legs to see if the length of the legs is the same and that the thighs and skin creases look symmetrical. Record this if it is not the case, as it may indicate problems with the hips. In male newborns, the urethral opening should be identified. If it is not situated at the tip of the glans but on the underside of the glans or shaft, it indicates a condition known as hypospadias. It should be recorded and may need further management. Observe the scrotum and palpate gently to confirm both testes have descended into the scrotal sac. Sometimes there is a collection of fluid in the scrotal sac. This is known as hydrocele and needs to be recorded, as it will require medical attention. In female newborns, check the outer and inner labia and the presence of a vaginal orifice. Check to see that the labia are not fused. Do not insert any instrument or finger to inspect the vaginal orifice. If possible, note also whether the child has passed urine, as this indicates whether the urethra is open or not. Observe the shape, length and symmetry of the legs and arms. Check whether there are any stiff joints. If there are, record the details. These problems tend to occur only on one side of the body. Observe if the legs are unusually bent or if either foot is positioned abnormally. If you turn one or both feet towards the midline and find it stiff and hard to do so, it is a feature of the club foot deformity. Record any unusual findings. You can observe the fingers by extending the newborn's curled fingers around your finger. Count the number of digits on each hand, whether the nails are present on each finger and thumb, and check whether the fingers are unusually short. You should see creases on the palms of the hands. These creases may be absent in premature babies. Sometimes there is only one line straight across the palm of the hand instead of two lighter ones. This is known as a transverse palmar crease and occurs in about 1% of newborns. It is usually harmless, but in rare cases it may be combined with other abnormalities and indicate a serious problem, and so should be recorded. Do the same with the toes. Count them. Place your thumb on the sole of the foot and the newborn will instinctively curl its toes over your thumb, making them easier to observe. Look for extra toes, missing or fused toes and missing toenails. Look to see whether there is any unusual webbing between the fingers or toes. This webbing is known as syndactyly. Check for skin creases on the soles of the feet. Record any unusual findings. Be sure that all your findings are clearly recorded in an antenatal record book or on an assessment sheet or form during or immediately after the examination. If you are not able to observe a particular part of the body, for example the eyes, indicate this clearly. Record if the baby has passed urine and stool. If the mother and baby leave the hospital within 6 hours of birth, counsel the mother to check if the baby passes urine or a stool within the first day. If this does not happen, ask the mother to bring the infant back for attention as soon as possible. Sign and date the examination record. It is a vital report of the health status of the newborn. When concluding your examination of the newborn, it is important to do the following. Wrap the baby again and hand it carefully to its mother. Reassure the mother clearly and positively that the baby is healthy. If you have found a problem, get confirmation or clarification from a doctor before telling the mother. If this is not possible, explain carefully and with consideration to the mother any problems or difficulties you have found and what action you are going to take. Report any abnormal, suspicious or unclear findings immediately to your superior.